Good afternoon. I am back with another video. In today's video, we are going to talk about OET speaking role play, how it works, what you need to do, what you need to say, do you do it correctly, how can you do it efficiently and properly to pass your OET speaking subtest. I'll give you 10 points where I will give you 10 points so you can pass your OET speaking subtest in one sitting. Okay, you need a pen and paper to watch this video so you can write down. So I'm going to give you a sequence. If you follow this sequence in your OET role play, there is no way that you are going to fail OET speaking. Okay, take a pen and paper, take your coffee or a drink if you need, and then start watching this video. You can pause the video if you have to go and grab your pen and paper. Okay, I'm going to discuss 10 points you should include in your OET speaking, and if you follow this sequence in playing your role play for OET speaking, for sure you are going to pass your exam. Okay, so we are going to discuss, as I said, what do you do in the role play. Check that what you are required to do is what you actually do in the role play. However, there may be things that you have to do instinctively. Yes, yeah. So we are going to follow a sequence. The first thing that you need to do is number one, write it down. Start with a simple greeting. Good morning, or good afternoon, or good evening, whatever the case may be. The second point is introduce yourself to the patient or carer and explain your title. In some contexts, you may need to do this, in others not. Okay, so the first point, start with a simple greeting. Second, introduce yourself to the patient or a carer and explain your role. For example, I go to the patient. Hi, good morning. This is Simon Adim. I'm your attending nurse today. I'll be looking after you today. Or, this is Saima. I'll be your nurse looking after you today. I'll be your attending nurse today. Okay. The third thing, find out what has happened or what the patient knows about a problem. All right. The third thing you need to know is what happened and what the patient knows about a problem. So you can ask the patient, what brought you to the hospital today? Could you please tell me why you're here? What happened? Can you please tell me what happened? All right, so these kind of questions. That's number 3. Number 4, the role plays may ask you information such as medical and family history, your lifestyle, previous hospitalization, and past diseases. So if the role play asks you to do that, do those things, you are going to ask the patients. If not, no need to do it. All right, if the role play asks you to get this information from the patient, or if they tell you the patient is having hypertension or a patient has had heart attack or something like that, then, or patient was hospitalized previously, you can gather some information about that. So I'm giving you the general tips and overall sequence how you need to do the OET speaking role play. But of course, you need to read the speaking role play question paper itself. Read it 2 times so you get the idea what they're asking you to do and how you are going to do it. Just make some notes on your question paper how you are going to do and what are you going to ask the patient at first. But honestly speaking is the most easiest subtest of all the subtests. All right, so speaking is the easiest one, and you can never do it it never goes as you plan. Okay, so you need to be fluent, you need to be you need to listen to the patient, what the patient is saying, in order to answer them properly. Because if you're not listening, then you can make mistake, and patient is saying something different and you're gonna say something different. So you need to listen to the patient very very attentively in order to pass your exam. Yes, this point also gives you marks if you are listening properly, and the examiner is noticing if you are paying attention to the question, if you are paying attention to the patient. Meanwhile, if you get an idea that patient is saying, I cannot concentrate, or I cannot take the tablets in the evening, or I cannot do the injections by myself. In your mind, you can also prepare your answer, but make sure that you are multitasking, you are listening to the patient and preparing your answer in your mind also. If you're not very fluent, you can just think that how I'm going to answer the patient. Or let's say patient is saying, I hate needles, so I hate needles. So while you listen to the patient and patient did not finish yet, you can prepare in your mind how you're going to answer the patient. Okay, so that was number 4, that whatever the role play says, you need to follow those things and answer to ask those questions to the patient. If they ask you to get history of the patient, get the history of the patient. If patient was hospitalized previously, ask the patient if they've been in the hospital and what was the problem. Number 5 on the list is, in some role plays, you may need to give advice on lifestyle changes, effective management of your condition. Yeah, it is very important, and most of the times they give you role plays where you need to give advice, because in those scenarios, in those role plays, they can assess your knowledge, they can assess your speaking capabilities, and they can assess how fluent you can speak in English and how properly you can give advice to the patient. All right, so advice given is very very important. I'm going to make some videos about OET speaking, where I will give you tasks to do at home, and if you practice those tasks, you'll be able to do it properly in your exam. So this was number 5, that you can get a topic about lifestyle changes and effective management of your condition. All right, number 6, you may be required to explain medication or treatment to the patient or a carer. So you need to know how to explain it to the patient. If you are giving any thyroxine tablet, you need to tell the patient whether they need to take it before breakfast or after breakfast. If they are taking any antihypertensives, they should take after the food, and they need to drink loads of water as well if their condition allows. So most of the times you get some role play about medication explanation also. That was the number 6 point. Number 7, the role play is no doubt require you to display a combination of skills. For example, ask information, give advice, reassure, negotiate, persuade. So you please make sure to watch my upcoming videos about OET speaking, because I've explained persuading, negotiating, empathizing with the patient, all those things in detail, in depth. All right, so don't miss those videos, and because you are going to use those in your OET speaking. Number 8 is, always remember that medical terms may be needed. Yeah, so you are the nurse, but the patient is not. Okay, medical terms you can tell the patient once. Let's say you can tell the patient about a medical term, and if they say I don't know about this condition, you can explain it to the patient in a layman term, explain it to them what happens in this condition. All right, so because the patient is not in medical field, they won't know all the medical terms. You can use them, but not very if they say that they don't know, you can explain it once and then you continue with the layman term. All right, at the end, number 9 is your you need to summarize your role play at the end. If you given any advice, you need to summarize it quickly, and explain the important bits, and again tell them that if you have any, ask them if they have any questions, if they worried about anything, if they didn't get your point, or if they want to ask you about something particular. This is your time to summarize summarize all the information that you have given. All right. And in at last, most important tip: be your own boss, be the boss of the patient, be the boss of your examiner, be confident, then only you can pass your OET speaking. Yes, I'm saying it right. I know. Okay. So because if you're not confident, you are going to I'm not saying that you're not going to fail your exam, but being confident can, you can stand out with it. And if you're not confident, if you're shy, or if you feel like you cannot manage very well in speaking, the examiners, they are just the role players, they are just the models. They are not they are not assessing you as such, because there will be a recording. They will record your session, OET speaking role play, and 2 or 3 examiners, they assess your English in that role play. So examiner at the moment, that time, he is not assessing you, he is not giving you points, he is not marking you for anything. So don't consider that person as an examiner. They are just the actors, they're just playing the role. Of course they are English teachers. I'm just making you feel like you are the boss. Okay. So always feel that when you go for exam, always be very confident, and be confident in saying what you have to say. All right, you are the nurse, patient is the examiner, and examiner, they are the role players, they are the actors. They don't know anything about medical term. Even though if you say wrong information in the OET speaking, it's all right. They are not judging you how well you know about a certain medical condition. All right, you may not know anything about that medical condition, but you are going to use the sequence that I've given you. If you are going to use the sequence that I've given you, for sure you will pass your exam. So in OET, they are not assessing your medical knowledge. They don't want you to be a doctor in a certain condition. They don't want you to know everything about heart diseases. They don't want you to know everything about hypertension. But as a nurse, you should be able to explain it to the patient. You should be able to give the pros and cons of a certain condition, and also you should be able to persuade the patient to take medications, or to give a lifestyle change, to give advice on lifestyle change or something like that. So but you are not the doctor. If you don't know any condition, just start with the normal conversation. And if you're not sure, just tell the person that I'm not sure, but I'll ask the doctor to come and talk to you about this condition. But in the OET role play, on the question paper, they will tell you what is this condition and what happens in this condition, and what advice you need to give to the patient, lifestyle changes. But you need to practice some conditions like simple ones: hypertension, diabetes, or smoking, or fever. Simple things you need to practice. And how you going to give advice to a patient who has these kind of simple conditions. Not simple conditions, I mean, these conditions are very common in OET. So you should practice with a colleague or friend how to give advice on certain topics, on these topics. A lot of the times they give topics like obesity, hypertension, or overweight, or smoking cessation. These are the things they give you role play on in the OET. And the best tip is always practice and think in English. Then you can do it in one go. You can pass your OET speaking in one go. That's it for today, guys. Thank you so much for watching. I hope you liked this video. If you did, please give it a big thumbs up. You can also share it with your friends and colleagues. And if this video was helpful and you learned something, put a heart in the comment section. Thank you so much for watching. Take care. Bye bye. God bless.